The United States' second worst wave of the pandemic appears to be on the decline. According to the CDC, nearly 29,000 new COVID cases were recorded Sunday. That's markedly down from the almost 184,000 new cases reported the month prior. For more, let's bring in our CBS News reporter covering public health and the pandemic, Alexander Tin. Hi there, Alex. So Johnson & Johnson is asking the FDA to authorize using their vaccine for follow-up booster shots, yet it wants the agency to decide who should get them and when. Is that different than how Pfizer and Moderna approached this?
Well, it's an interesting question. And to be clear, ahead of, Pfizer getting authorization for its booster shots, ahead of Moderna, which has yet to get authorization for its booster shots, and then obviously ahead of Johnson & Johnson getting authorization for its booster shots, all three companies' executives were very clear every time they were asked about it, when they would show up on shareholder calls or interviews with the media, that, look, we think there's data potentially supporting use of a booster shot of our vaccine. We think it's potentially effective. But it's up to the public health officials. It's up to the regulators. It's not on us to tell them what to do. It's just on us to give them the data to help support their decisions about booster shots. With that said, it is true that there is a real and marked difference between how Johnson & Johnson has pursued its submission for a booster shot authorization versus Moderna and Pfizer, which not only have been very vocal about their support for a potential booster shot of its vaccines, but in some cases has not only funded large studies examining the potential need and efficacy and safety of booster shots, but also has been vocal in interviews and in press conferences and with shareholders that they were actively pursuing sales of those booster shots with various countries. We have not seen the same kind of push with Johnson & Johnson. Although the company did fund studies examining the potential use of a booster shot, what you saw in its release today announcing that they had submitted this request for authorization from FDA was that even in that release, they were careful to say, look, we still have data showing that our single shot vaccine appears to have durable and high protection against the most severe forms of COVID-19. So despite what you may hear about, potential relative less protection from our vaccine versus other vaccines, I think the message that we've heard from Johnson & Johnson is clear. It's, yes, you might see a potential increase of protection with a booster shot, but don't mix that up for us saying that we think our shot is no longer effective at preventing severe COVID-19.
Well, Alex, we learned on Tuesday that a fourth person has died from blood clots after receiving the Johnson & Johnson COVID vaccine. Vaccine safety and the adverse effects reported on the Health and Human Services website are often cited by the vaccine hesitant. What do we know about health risks from vaccination?
Yeah, well, it's an interesting case. And, we heard from Washington state health officials that they are actually working with federal health officials with the CDC in looking into this case of somebody who died from a blood clot after receiving the Johnson & Johnson vaccine, potentially linked to the vaccine. But let's be clear about the facts, right? This, if it is linked to the Johnson & Johnson vaccine, is a risk that was carefully vetted and examined by federal health officials, both here in the United States and around the world and all the other countries that are using Johnson & Johnson's vaccine. And at the time then, even before we saw this huge surge in COVID-19 from the Delta variant that we're seeing now, most health authorities confirmed that they believed that the benefits of the Johnson & Johnson vaccine so clearly outweighed this very rare risk of a potential thrombosis with thrombocytopenia. That's this rare blood clotting syndrome that we've seen in only a handful of people who've received this vaccine, that the risks of that syndrome were so far outweighed by the benefits of getting the vaccine and preventing that severe COVID-19 that everyone is concerned about. And obviously, since that meeting, since that determination, the CDC and FDA have continued to publicly report and track, all these cases that have potentially come up that might be cases of thrombosis with thrombocytopenia. And in their tally of the cases, the last time I checked, there were only 47 confirmed reports out of nearly 15 million people in the United States who have received the Johnson & Johnson vaccine.
All right, important context there. Looking ahead, Alex, Dr. Anthony Fauci is saying it is too soon to know if Americans should avoid gatherings in the upcoming holiday season. Do we know when the CDC might make that call?
Yeah, well, it is an interesting question. And if you'll just go along on the journey with me for a second, let's start on Sunday, which is when Dr. Fauci was asked about that on Face the Nation. He was asked about that in the context of asking him, yes, we're seeing this decline in cases, but we know that spread of the virus is still high. We know that so many Americans are still unvaccinated against COVID-19. Where do you see this pandemic going? In the context of that, Margaret Brennan, the host of Face the Nation, asked Dr. Fauci, is it too soon to know if, and I have the exact wording of the question here, if we can gather for Christmas or if it's just too soon to tell? Now, his answer in that situation, he has said later on CNN and on ABC and other interviews that he thought was taken out of context, that he personally is planning on gathering with his family, and he thinks that CDC guidance is very clear that if you are gathering with your family and your household, it is perfectly fine for you to continue gathering with them. Where it gets more tricky is when you're talking about indoor gatherings with people that are outside of your immediate household, where you're talking about travel and people who you don't know their vaccination status. That has obviously become more complicated in the context of the Delta variant, where we know the CDC has said, especially in indoor gatherings that are in so-called public spaces with other people you don't know well, that's where the risk gets increased even for fully vaccinated people when you are in a situation of substantial or high spread of the disease. And last I checked, the CDC said more than 90% of counties are in either substantial or high transmission of the disease, which means at this moment, in most situations, if you are in public, indoors, whether or not you are vaccinated, the CDC still recommends that you wear masks.
Okay, what about in the short term here? What is the CDC saying about Halloween?
Well, what you heard both from Dr. Fauci and what you've heard from the CDC is that, especially if you're outdoors, you're probably fine. Especially if you're distancing, you're probably fine. It's because we know that even in the context of the Delta variant, when you are outdoors or in well-ventilated spaces, your risk of catching COVID-19 and of spreading COVID-19 is very low. But of course, that gets more complicated when you get into crowded situations or less ventilated spaces. So even in those situations, it's something that you're going to have to take and consider very carefully. But as long as you're outdoors, you're in a well-ventilated space, and it's not too crowded, you're probably fine.
All right, some good news. Alexandra Tin for us. Alex, always great to have you. Thank you.
Thank you.